Welcome to Vital Signs. I'm your host, Jen Gudet, and we're here to talk about your most important and valuable asset, your health. Today, we're going to dive into revolutionary advances that are helping people regain mobility and independence after life-altering injuries. I'm really honored to be joined here by Rodger DeRose, the president and CEO of Kessler Foundation. Kessler Foundation is one of the largest public charities in the United States. It's focused on rehabilitation research and disability employment. With decades of executive experience, including senior living leadership, Rodger has transitioned into that nonprofit world, and he's really making a direct and lasting impact on people's lives. Rodger, thank you for joining us, and welcome to the show.
Pleasure, Jen. Thank you. And it's a pleasure to be with your viewers as well. Thank you.
Thank you. So let's begin with one of the most exciting areas in rehabilitation. I'm a physical therapist by trade, so this was particularly intriguing to me, and that's spinal cord injuries. Spinal cord injuries used to mean permanent loss, but now we're seeing breakthroughs that are really rewriting what recovery looks like. You're addressing mobility issues, and the recovery options seem like they're almost unlimited with where you're going with the regenerative techniques and the spinal stimulation. So talk to me a little bit about the breakthroughs in spinal stimulation and which ones have shown the most promise. Like, what does this look like at a ground level as we work with rehabilitating patients?
Great topic to start on, Jen, because if you had to pick one area in the portfolio of research that we work on, spinal stimulation and what is going on in this whole field of neuromodulation, whether it's the brain or the spinal cord, the connection points between both of them, it is truly an exciting area. And I think there are so many great centers around the country and around the world that are working in this area. For us, we're so fortunate to be funded by a major donor who is a wheelchair user who happened to have a spinal cord injury about 25 years ago. His name is Tim Reynolds. He and his wife, Tim and Caroline, have basically given us the initial funding to get us started in this whole area of spinal stimulation. And what was incurable probably 5, 10, 15, 20 years ago, we're now starting to see cures take place in many of these functional issues that a spinal cord patient has to live with every day, whether that is bowel and bladder control, whether it's sexual function, whether it is spasticity and movement, locomotion below the level of injury, whether it's blood pressure. Many of these areas are now being controlled through spinal stimulation. And we have been working in this area for about 15 years now with the University of Louisville. And many of their individuals from the university have now come over to join our research team here at Kessler Foundation, and we're so excited to have them here. But this is where the breakthroughs are really happening in terms of reconnecting brain intention with healthy neurons that are still active and living in the spinal cord column, and finding their way to connect those so that when the brain is actually giving a command to the body, that it is actually listening to that, finding a pathway to those healthy neurons, and allowing the action to occur that is addressing many of these functional issues that a patient has to live with, from whether it's standing, whether it is blood pressure control, whether it is sexual function. Many of these areas can now be controlled through the algorithms that are being used to make this connection between the brain as well as the spinal cord and other areas that the body needs the attention to address the issues that the patient is living with.
So talk to
Exciting.
So it's really exciting. I've worked with so many athletes in the past that have had a partial or a complete. It really could be it's a life altering injury. And it's really exciting that now we can start to see some of these breakthroughs. But talk to me about what makes Kessler Foundation's approach different because you blend research with real, true clinical application and innovation. So, talk to me about how your approach is different and how you've been able to really make these breakthroughs, maybe through a patient story or a turnaround or something that so that the viewers can really connect with what this means in the real world.
Sure. Yeah, we're so fortunate to have Kessler Institute for Rehabilitation right on the premises here. So we're kind of vertically integrated where inpatients and outpatients are entering into our research protocols that we have here. So there's never, one of the big issues for many research organizations is finding the patients. And we don't have that problem. We have patients from not only spinal cord, but brain injury and stroke and multiple sclerosis and other neuromuscular conditions as well. But the hospital acts as our laboratory, if you will, where we can actually meet with the patients and work with the clinicians as well, whether it's the doctors, the nurses, the PTs, the OTs. It allows us to discover what the issues are and then try to make the next interventions that are going to really jumpstart and catapult care in a better way in the future. So for us, patients that may not have even been a patient at Kessler have heard about the breakthrough work that is going on in our Reynolds Spinal Simulation Center, and they sign up for the projects and they interview with our doctors and determine whether or not they're a candidate for the types of spinal stimulation that we do. We do two types of spinal stimulation. One is the transcutaneous, which is actually electrodes that are over the skin, over the spine. They're not actually implanted. Second is an epidural implant that actually is done through surgery and is done on the lower lumbar area. And these are the two stimulations that we have become experts in. We're one of the few centers that is really leading the way in both of these areas. And this is how patients find us and really reach out to us to find ways that they can get here and participate in our research studies. Our hope is that we don't want, and the donor, Tim Reynolds, and his wife, Caroline, do not want this technology to sit on the shelf. What they want, above all, is consortium building. They want hospitals to join in. They want us to push this out and provide our consulting knowledge to those hospitals so that more patients can participate in it. So there are many stories of success in this area that we've worked on. In transcutaneous, we started our epidural implants in November of 24. We've done 3 implants now. We've done over 200 transcutaneous stimulation studies with patients, and everyone benefits by it that has participated in it, Jen. So it's very exciting.
It is exciting. And I have a question for you because, and we may have to take this into the next segment based on time, but you and I have talked about some of the regenerative techniques like PRP, fat cell injections, some of the other things that accelerate healing and function. Have you integrated those into the recovery paths with, for example, the implants, the implanted stem, or and how has that accelerated healing? And what are you seeing as these technologies converge?
What a great question, Jen. It really is. And I don't know any organization that has integrated platelet-rich plasma or fat tissue as an injection into the spinal cord area yet in addition to spinal stimulation. But it is a question, and here's the reason why I think it's so important. And it's an area for exploration. And that is that if you can reduce the scar tissue in the spinal cord for patients that may come for epidural implants or transcutaneous that are 5, 6, 10 years post-injury, you can imagine being an individual with your background, the scar tissue that interferes with the connection points between the brain intention and those healthy neurons that are still living in the spinal cord. And so if we can reduce the scar tissue, if we can bring a healing factor much faster through platelet-rich plasma, or fat injection, MFAT injection. I think it's a very worthy area in question from a research perspective to be involved in. We are currently using MFAT tissue for shoulder tears in spinal cord patients that are wheelchair pushers, right? They're pushing that wheelchair every day. And one of the first things to go, as you know,
Mhm.
is shoulder injuries and tendons. And so we've been using the MFAT tissue to inject into those areas, and the recovery from that is really remarkable. In the studies that we've been involved in, that we've been doing here, we're seeing 70 and 80% recovery rate from the tissue damage that's been caused by pushing their wheelchair. So it's really an amazing technology to combine, I think, long term with epidural and transcutaneous stimulation. We're just not there yet.
Oh, it's a fun thing to explore, and it's
It
really
is.
fascinating to me. And for those of you who are viewing, this is really life-altering breakthroughs that they are working on. We do have to take a brief break, but up next, we're going to talk about how robotics are transforming human movement. Yes, exoskeletons are real. It's not just sci-fi anymore, and they're helping people to walk again. We'll dive into that after these important messages. Welcome back to Vital Signs. Loving what you're watching? Stay connected to Vital Signs and every Now Media TV favorite, live or on demand, anytime you like. Download the free Now Media TV app on Roku or iOS and unlock nonstop bilingual program. On the move, you can also catch the podcast version right from our website at www.nowmedia.tv. From business and news to lifestyle, culture, and more, we are streaming around the clock, ready when you are. Let's get right back into our topic today. Science fiction isn't fiction anymore. Robotic exoskeletons are helping people regain their independence, and that's just the beginning. I'm here with Rodger DeRose, and we're going to dive into robotics and rehabilitation. What was once science fiction is now transforming lives. Rodger, let's talk about robotics, exoskeletons, balance bots, the smart technology that's making recovery more effective. What kind of robotic technology is being used at Kessler Foundation today?
Wow, Jen, I tell you, when you pick topics, you pick the big ones. These are like the grand slams of mobility issues that individuals that we work with here, that are our patients, whether they have a spinal cord injury, a brain injury, strokes, where they've had mobility challenges, MS. So you've really picked on a great area, and robotics is such an exciting area. You know, we were I think, the second major rehabilitation organization in the country when Exobionics launched their robotic device in 2011. And so we took possession as a very proud rehabilitation research organization to do research in this area. And I can tell you that we've had almost every robotic manufacturer on our campus working with us, and they want to reach out to us because in many cases they're looking for data that will help them from an FDA clearance perspective. And sometimes they'll start in a narrow window of, for example, spinal cord injury. And we can use Exobionics as an example of that, where when they launched their product, they had FDA approval for spinal cord injury. And this is where we take an individual with a spinal cord, whether they have a complete injury or an incomplete injury, and place them into the robot and actually watch them walk again. And when a family member or a patient has the opportunity to walk again after a neurosurgeon or an orthopedic surgeon who did the surgery on them said, "You'll never walk again, and you'll have to get used to that as a life-changing issue," you can actually see the emotion in the patient. So Exobionics was one. They were the first. And when they came to us, we said, we'll work with you in spinal cord injury. We will help you and do everything that we can to help collect data and assist you in making a better product in iterations of your bionic unit, your exoskeleton unit. But you're really missing the bigger picture. And the bigger picture is we have so many other mobility challenges that we deal with, from strokes. Well, there are 800,000 strokes in the United States every year, and many of them have mobility challenges. That's just one area. Traumatic brain injury, there's often an association with mobility challenges there. Multiple sclerosis, because the lesions are not only growing on the brain, but they're growing on the spinal cord as well. And these create mobility challenges. And when you can put patients into robotics, exoskeletons like the Exobionic unit, or many of the other units that we have on the campus, from Rewalk to Indigo to the Wandercraft from France that just came out about 2 years ago, and is probably some of the greatest technology in exoskeletons that we have seen. It leads to so much of the excitement that we're seeing in lower mobility challenges, but it never doesn't stop there, Jen. It actually the robotic devices are now also for upper mobility challenges as well, for stroke patients that have limited movement, or spinal cord patients that have limited movement, for upper mobility. So we're seeing, if you came here to our campus, you'd see robots which happen to have people in them walking down the hallways, and seeing the just the pride that individuals have to be walking again, where they were told that they would never walk, and we're seeing it with these robotic devices. I think the technology breakthroughs over the next 10 years are going to be remarkable in exoskeletons, upper exoskeletons as well as lower exoskeletons.
And the mental health aspect and the quality of life aspect of regaining independence when it's been lost, there is no way to really articulate that unless you or a loved one has lived that life. It is so tremendously, like, it gives me chills thinking about this and where we're going, because of how transformative that is to the lives of these patients and their families. So talk to me a little bit about how you're ensuring that this tech is scalable and accessible in the future. You're working with these companies, you're partnering with these companies, you're helping them get their FDA clearance. Like, how do you ensure that this technology is going to be accessible in the future? And maybe tie in the role of private philanthropy and partnership in accelerating this technology coming to market, because I know that our viewers are like, well, that sounds great, but I'm sure that's only for the wealthy few, right? That's the first thing that people immediately think of when they see new technology.
Absolutely, Jen. And that's where it was. But what's happening now, and I'll give you a couple of examples, is that insurance companies and the Veterans Administration, for example, are starting to cover the cost of these exoskeletons. Let's just take the VA as an example. The VA is covering the cost of an exoskeleton for a veteran that has had a mobility challenge from their service to the country. And these are expensive units, as you say. I mean, the manufacturing of these they're not a pair of pants, that's for sure. They're $100,000 plus, and some are even more expensive when you get into some of the other units that have more motors in them for balance. The scalability of these is going to have to be covered by insurance companies. And let's just talk about what the benefit is from a healthcare perspective. If you can get patients with a spinal cord injury, for example, into a robotic device, and you can reduce some of the long-term issues that they have from a healthcare perspective, whether that's blood pressure, whether it's muscle atrophy, whether it's bone density related issues, and you can get them walking in a robotic device, you're going to minimize many of those long-term issues that insurance companies, that other healthcare organizations are going to have to deal with, which are very expensive long-term for the caring of a spinal cord patient over their lifetime. So I believe that insurance companies are going to have to look at what is the cost value of covering the cost of a robotic device for a spinal cord patient if you can minimize pressure wounds, for example. And for example, if a spinal cord patient had to go into the hospital, have plastic surgery, have wound treatment, and that costs $100,000 for one treatment over a period of 6 to 8 weeks in a hospital, uh, what makes sense to cover the cost of the robot at $100,000 and minimize those long-term issues, healthcare issues that a patient would have, or not cover it? And I think that that's where the manufacturers and the insurance companies are going to have to work together to come up with a solution and look at the long-term cost and return on investment for the patient as well as for the manufacturer and the insurance company.
Right. And, I also go to from an economic standpoint, as more and more devices come into use and more partnerships, they're able to bring down the cost of manufacturing as well over time. So I couldn't agree more. Like the costs associated with spinal cord injury, and they're tremendous. And it's not just the cost to insurance company. It's an entire life cost as well, because once you have the ability to pick yourself up and move, and then you can be gainfully employed. It changes the game altogether, in every aspect that we look. Thank you so much for diving into this. I know we're running towards the end of this segment. I'm going to have to take a break, but if you're watching this and you're listening to this, all of these technologies, they're here, they're now. These are things that are working currently. And if you're watching and you're like, well, how do I get involved? Check out Kessler Foundation, check out what they're doing, become a donor, get involved, talk to your insurance companies. The more advocates that we have when we look at innovation in healthcare, the faster we're able to bring this to the public. It literally is a matter of us using our voice. It could be as simple as us using our voice and voting for these things. So find a way, reach out to Rodger, do some research with Kessler Foundation, and get involved, because we never know who it is that is going to be impacted by these mobility challenges. And the reality is a lot of folks in the United States. So definitely reach out. We do have to take a brief break, but we are going to come out of the gates talking about longevity, peak performance, and brain health, and how the answer lies in proactive care as opposed to waiting for a diagnosis after these important messages. Welcome back to Vital Signs. What if rehab wasn't just for recovery, but the key to living longer, sharper, stronger lives? I'm here with Rodger DeRose. He is with the Kessler Foundation, and we're going to move into the future of proactive care, longevity, brain health. Instead of waiting for decline, what new research is out there? What is it showing on how we can stay sharp and mobile for longer? we've just talked about some really interesting topics in spinal cord injury and in robotics. But one of the things that people fear more than anything is aging and cognitive decline. So I'm going to ask you, Rodger, what has Kessler Foundation been working on? What does the cognitive health research, what does it reveal about prevention and early detection if you have that as well?
Well, that's another great topic, Jen. And our neuroscience lab has been working in this area of memory recovery, particularly as it relates to traumatic brain injury related issues, stroke related issues, spinal cord related issues, multiple sclerosis. And our lab, led by Dr. Nancy Cervelati, has developed a program that has been used in clinical care now for about 15 years. And it's a story memory training program that really works on the basis of working on content and using content modules to help the individual regain lost memory capability. And so, in working with many of the patients that we do work with, this technique is being used from a clinical care perspective. And Dr. Nancy Cervelati has become really one of the experts in the field of this area. We're using it for early signs of dementia as well, and we're testing in that population. And I wouldn't be too surprised if you'll see us working in this segment, in the Alzheimer's segment as well, to try to stave off the issues that patients may have. And one of the big issues is that we find is that if a patient has cognitive reserve, the ability where they've engaged their mind in aspects that have been challenging for all of their adult life, they have a longer outcome in terms of not having dementia or Alzheimer's. In fact, many times an individual that has been diagnosed after they're deceased, that they've been told they've had Alzheimer's, you've seen less of a decline in those individuals because of cognitive reserve. And so there are many studies that our neuroscience lab is working on in this area, and I think it's going to be breakthrough for the future of cognition and staying mentally sharp as you go through many of these diseases and illnesses and injuries that we see and we deal with every day.
There's been a lot of links to strength and particularly lower extremity strength and muscle mass with cognitive function. How does movement-based rehabilitation support brain function and longevity? How are those linked in what you're doing? And maybe what's the vision for integrating mobility plus brain training as core longevity tools moving forward?
Dr. Karen Nolan from our scientific staff has a study that a research study that she's involved in right now on that very topic. And we're doing it in conjunction with another major rehab hospital here in the United States. But Dr. Karen Nolan is leading the study here on this campus, as well as the campus in the Midwest as well. And the idea is to combine stimulation and robotics in terms of that movement and that stimulation that can assist an individual's ability to regain memory as well as sharpen memory. And we're also doing this in the area of multiple sclerosis with MS patients using exercise and studying how exercise can delay the outcome of mental fatigue as well as long-term dementia-related issues.
Fascinating. I think that we've seen this and we've known this clinically, that the more like movement produces a lot of blood, like it's circulation, it's blood flow, it's oxygenization to the brain. So we've seen this clinically, but we haven't really had the research background to say, yes, this is what it is, this is what it is for this patient population, and this is how it's going. So it's really fascinating to me because what I'm hearing is you guys are really drawing those connections and proving the things that clinicians we sort of already have seen and known and suspected in a clinical setting. But once we have that data, then we can apply that from a prevention standpoint as well. So let me ask you, what are you most excited about? What's coming down the pipes in the next 5 to 10 years that really, like, it's so exciting it keeps you up at night?
Well, I think where we started is one of the really exciting areas, and that is the neuromodulation, the spinal stimulation of the spinal cord, of the brain, and the benefits, the long-term benefits that is going to provide in terms of addressing many of these areas that we thought were incurable, that can now be cured. While locomotion, movement is the hardest one to address right now. Other areas are being addressed scientifically, and we're seeing great results with the patients. I think the other area that is really exciting as well is the work that we will continue to do in robotics, Jen, because these are going to get, as you had asked earlier, you're going to see manufacturers bring the price down. They're going to be more cost competitive. And I think within the next decade or so, we're going to start to see much smaller versions of these that are going to actually be taken right into the household. That you can, it may not be an Iron Man suit, it may not be a pair of pants that you slip on, but it'll be a much more manageable robotic device that will allow you independence in the home and in the community and in the workplace. So I think these are some of the exciting areas that we're working in. And, it's when you work in the portfolio of research that we and our scientists are working in, it's what gets you up in the morning. It's what allows you to drive to the office motivated and spend the long hours that our researchers do spend trying to address these issues on a daily basis to help patients live a more fulfilling life and add value to their lives after they've come across an illness or a major injury that has changed their life at that moment in time.
And I think about the overarching impacts as well. I mean, I've seen the exoskeletons being used on relatively healthy individuals in the workplace in Japan, for example, older individuals leveraging the robotics in order to help reduce strain, biological strain and musculoskeletal strain in lifting and some of those things. So I'm really excited about what the implications are as these things become more and more used, both in the well population as well as in the clinical with a diagnosis. So I didn't get to ask you because we ran out of time in the last segment, but I'd really love for you to share, how can people learn more about Kessler Foundation? How can they learn more about some of the research they're doing? How can they advocate for some of these things in their community hospitals or whatnot, so that we can see more of these partnerships and really usher in the future of medicine, and how we do life, really?
Well, thank you, Jen. That's so nice of you to ask that question as a closing question. And, the first place, of course, is to go to the website, kesslerfoundation.org, and click on the research button just to see the breadth of research that our scientists are involved in. We have so many clinical studies, research studies that are taking place right now that if they're capable and interested in being a participant in our research and they qualify for the research, that we're always looking for new research subjects to come into our studies. And that includes not only individuals that have the injury or the illness, but also you're always comparing this against healthy subjects as well. So we also are always looking for healthy subjects to do a baseline in some of the research studies. So I would encourage them to go to the site, read about our scientists and the research that they're doing. They are world-class scientists that are competing every day for NIH awards and Department of Defense awards and other major grants that the federal agencies, the state agencies, private foundations are offering. And in many cases, usually 30% of the time that we get up to the batter's box, our scientists are winning those grants. So it's a very high percentage that they have as a win rate. So we're very, very proud of them, and we do everything that we can to make sure that we keep them motivated, and their passion is certainly something that comes through every day when they come into the office and into the research labs to work with so many of the patients that we work with.
Absolutely. Thank you for that. So, folks, you heard it here. Go to KesslerFoundation.org, learn about what they're doing. If you or a loved one is interested in participating in their studies, get involved, because this is how we work together and really bring the future of health and taking care of our greatest asset. In our final segment, we're going to talk about access. We're going to talk about equity. We're going to talk about how Kessler Foundation is making sure this future isn't reserved only for the privileged few. So you're going to want to stick around as we conclude and wrap this up with a nice bow. We will be right back after these messages. Welcome back to Vital Signs. Don't miss a moment of this show or any of your Now Media TV favorites, streaming live and on demand, wherever, whenever you want. Make sure you grab that free Now Media TV app on Roku or iOS and have access to our lineup of bilingual programming. If you prefer podcasts, make sure you listen to Vital Signs anytime on nowmedia.tv. Our website is available to you, and you can check it out podcast format. We're covering business, breaking news, lifestyle, culture, and more, available 24/7, so the stories you care about are always within reach. Now, without further ado, let's dive back into our topic. We have had a great conversation with Rodger DeRose today of Kessler Foundation. They're doing amazing things, but innovation without access isn't progress. Kessler Foundation is proving that science, strategy, and philosophy and philanthropy must work together so that we can actually change lives at scale. So as we think about closing today, we've talked about a lot of topics, Rodger, but we didn't touch on autism. And I know when we spoke before, you were excited about some of the research you're doing with autism spectrum disorder. I want to give you a moment to kind of share what's happening with regards to that in Kessler Foundation today.
Well, thanks, Jen. That is such another exciting area of research that we've been involved in. We have a scientist here that is leading the Center for Autism Research. She is the mother of a child that has autism. He's in college now. And one of the areas that she is focused on and has created a product which is called KF Stride, it's an animated product that is really targeted to help individuals with autism and neurodivergence type challenges in terms of transition-aged youth that are going into the workforce. And one of the biggest challenges that individuals with autism have is finding a job. The unemployment rate for people with autism, for individuals, young individuals with autism, is astronomical. And so I think when you talk to a parent that has a child with autism, one of their great concerns is what kind of a world am I leaving for them? And are they going to be able to be independent? And can they find a job? and find that kind of independence. And so the project that our scientists have worked on, led by Dr. Helen Genova, has been this particular animated product that we are now pushing out to schools and to vocational research, other vocational research organizations, as well as departments of vocation in different states, where they can access this particular product and help transition-aged youth sharpen their skill sets so they have a much better batting average when they go into the interview, because oftentimes they just are not prepared to answer the types of questions that interviewers have for them. And this positions them to have a fair chance at becoming employed in the setting that they are interviewing for. And so we're very, very proud of this work and this product that our science group has created and is now pushing out to the market. Very excited about it. KF Stride, and I would encourage them to go to our website and read more about this product if they have any association to autism as an area of interest.
I definitely encourage that of everyone. I know it's a large topic. I know that diagnosis is on the rise. And so neurodivergence in general is something that we have to take care of and think about differently so that we can provide for the future. So Rodger, thank you for that. I'm really excited about everything that you've discussed. And we know breakthroughs often get stuck in labs, but patients need access to that care. Scaling requires funding, partnerships, equity, the things that we've talked about a little bit and touched on a little bit. But can you talk to me about how Kessler, what their approach is to diversity, equity, and inclusion in the research access, and also what viewers can do as donors, advocates, or professionals to support your mission?
Sure. Well, we're very fortunate as an organization to compete and win these great model systems that the federal government puts out every 5 years. And in spinal cord injury, as an example, and in brain injury, as another example, there are model systems, centers of excellence, if you will, across the country. And Kessler Foundation, along with Kessler Institute and our partners, have held the Spinal Cord Injury Model System Center for Excellence for over 35 years now. And this is a grant that you compete for every 5 years. We've done the same in traumatic brain injury. And when these grants are written and they are reviewed by other scientific peer-reviewed scientists that review them with consumers, the one area that they look for is, how are you treating the entire population? How are you treating the minority populations in the area, the catchment area that you serve? And we're very, very proud of how we have built in diversity, inclusion in all of our research, not just in spinal cord, not just in brain injury, but in stroke and MS and all of the other conditions that we talked about, including autism as well. So it's embedded in the culture of the organization to be very diverse, including the makeup of our employees. If you looked at our employee base of about 200 employees, you would see the diversity that we have, and that is factored into how we reach out to patients and research subjects that come into our studies as well. So it's embedded in the culture and in the DNA of our organization, Jen, and we're very proud of it.
It's really important too, because when medicine shifted towards evidence-based practice really strongly, with managed care and whatnot at the turn of the century, especially, a lot of the research done prior to the turn of the century was predominantly male and predominantly certain ethnicities, and we applied, or at the time, that research was applied to everyone, and we've learned that biodiversity is the rule, not the exception, and then it's really important to have that. So it's really nice to hear that this is a part of your culture, and you guys really have just woven that in so great. So now let's shift to what viewers can do. How anyone who's watching and they feel called to support your mission, what can they do, whether it's as a donor, as an advocate, as a professional? How can they get involved?
Well, let's take them individually. If they're interested in as being a research participant in our research studies, to go to our website and look at all of the research topics and studies that we have going on, and whether or not they would like to sign up and be a participant and qualify for those research studies. That's one area. If they're donor interested, for example, if they have a loved one with a spinal cord injury, a brain injury, a stroke, and they enjoy and are moved by the type of research that we're doing that is actually having a benefit and an impact on changing the life of that individual, they can always donate on our website as well, or just reach out to me or to Michelle Pignatello, our Chief Development Officer, and let us know what questions they may have and how they might want to be involved from a donation point of view. If they are researchers and want to be collaborators with us, we're always looking to collaborate around the country and around the world with other leading researchers that are in the field. You know, the one thing you never want to do, Jen, as you can appreciate, is become so isolated that you think that you have all of the answers, because you don't. And I think it's that kind of collaboration that brings about faster, more efficient, and cost-reduced care for so many individuals that we work with as well. So if you're a researcher and you go out to our site and you can identify with a researcher that is working in an area of yours, please reach out to them and tell them about the work you're doing and that you'd be interested in collaborating with us on a particular research project. So there are so many areas that individuals, your viewer base, can get involved in here at Kessler Foundation.
Thank you so much. This has been such an inspiring conversation. And for those of you watching, make sure you go to kesslerfoundation.com and get involved, or .org, sorry, and get
.org.
involved. Rodger, thank you so much for joining us, sharing your vision for the future of rehabilitation and healthcare. From
Thank
spinal
you.
stimulation to robotics, protective brain health, scaling care, you've really kind of given us a peek behind the curtain into a future where recovery and resilience are going to be possible for so many more. Thank you so much for your time.
Thank you so much, Jen. We really appreciate it for all of the time and research that you've done on the topics that we talked about here today. So thank you very much.
Absolutely. And to my viewers, yes, you can't afford to wait for better care to come to you. This is the moment to get involved, to get informed, to get proactive about your health. You know, it's our greatest asset. Learn more about the work that Kessler Foundation is doing and how it might change your future or the future of your loved ones. I'm Jen Gudet, and this has been Vital Signs on Now Media TV. You know, all good things come to an end, including this show. But the good news is we'll be here same time, same station next week. So until then, stay strong, stay hopeful, and stay well.